Welcome. My name is Tracy Reed, and I'm a national jail consultant for the Legal and Liability Risk Management Institute. Over the course of the past 26 years, I have been involved in corrections in one way or the other. Um, my experience started back in the early 90s as a probation and parole officer. From there, I worked 14 years or so as that and transferred to as a jail inspector with the Department of Corrections in Kentucky. I retired from there after 25 years essentially there. And since then, in 2013, when I retired, I've been working as a national jail consultant privately and throughout the United States doing expert witness work, additional training throughout the United States, and various other things. So, hopefully, that throughout the course of my career, I've been able to accomplish some things to help share with you. And today, we're going to talk about planning for the impact of COVID-19 in your jail. I hope you find this information beneficial to you as you begin to navigate these uncharted waters that lies ahead. So, what you may know or may not know it from the coronavirus is it's been around forever. It's one of those viruses that causes the common cold, and which is a nuisance, by the way. I've got one, so apologize for sounding like a frog in a can, but it's really not a pandemic concern. However, this particular virus has mutated, causing the new COVID 19 coronavirus. From what is currently known about this virus, it makes people sicker than the old version and is more easily transmitted from person to person. These two properties have turned the disease COVID 19 into a global threat. Because this virus is more easily transmitted from person to person, all jails across the United States should be actively preparing for it to show up in your facility. Over the past couple of weeks, I have immersed myself in this topic, researching information provided by the Centers for Disease Control, the World Health Organization, listening to webinars presented by the National Commission on Correctional Health Care, as well as the American Correctional Association and the American Jail Association. In addition to researching what other agencies across the United States are doing to implement precautions in their own facilities. My intent with this presentation is to combine into one source all the relative information extracted from those national sources. Finally, you will find listed on the resource slide at the end of this presentation all the sources I used or that have been cited today. Because new information is learned daily about this virus, I encourage you to frequently check out the Center for Disease Control's website, as well as the other resources listed at the end of this presentation, in order to stay on top of any new developments. All right, so let's get started. Unless you've been living under a rock, no doubt you have seen the stories on how folks were stranded on a cruise ship for up to 14 days or sometimes longer after a positive case of the virus was discovered. Little did they know that when they left for their 3-day cruise, it would extend out much longer than that. Much like cruise ships, jails or prisons are also self enclosed environments where individuals dwell in close proximity. And just like passengers on a cruise ship, incarcerated persons sleep in close quarters, eat together, recreate in small spaces, staff are close by. Because of that, both those incarcerated and those who watch over them are at risk for airborne infections. If you understand this correlation, then you can easily see why it is essential to formulate a plan now before a positive case is identified in your facility. It is our responsibility to everyone concerned to be proactive rather than reactive. Let's face it, folks, if you run a jail or a prison, a small lockup of some sort, you are accustomed to seeing arrestees that present at intake with a variety of medical issues. Oftentimes, the folks that we see admitted into our facilities have not taken the best physical care of themselves. Add to that the number of new intakes that come in with some form of a substance abuse problem, logic tells us that a big majority of those folks housed in our correctional systems are going to have compromised immune systems. According to the CDC, the group of people most susceptible to this virus include older folks, 60 years of age or older, and anyone with a compromised immune system. Remember, a compromised immune system could include anyone, any age, with an infection or serious underlying medical disease, such as heart disease or diabetes, some autoimmune disease, etc. The Center for Disease Control and the World Health Organization both agree that this group is more likely to experience death should they contract the virus. With that in mind, you and your medical provider should agree on a plan of action on how you can ensure everyone's safety and health. Because this virus is so easily spread, it is imperative that we act now to formulate a plan on how you're going to address this threat if it finds your way into your local jail. This means that even if your community has no active cases of COVID 19, you must prepare as if you do. Finally, I would encourage you to consult with your local public health authority so you can better understand if transmission of COVID 19 is occurring in your community and what resources are available to you. Also, it's a good idea to not delay in contacting them to make sure that your correctional health services are included in their regional planning. When I first started putting this information together a couple of weeks ago, only a few states had identified as having positive cases of the virus. As of now, the number of cases, all states have now positive cases identified in their states. The number of cases in each community have only been increasing in number. As such, local jurisdictions should just now assume it is already in your community and move to restrict visitors and unnecessary traffic from your facility. Cancel all group activities and communal dining, and implement active screening of new arrestees, visitors, and staff for fever and respiratory symptoms. So you're probably thinking now, where do I start? Well, first off, when developing or updating your current plan of action, I recommend that you take the multidisciplinary approach. For example, it's a good idea to include anyone who has a vested interest in your facility. That could include your medical authority, someone from your custody side, your administrative side, health department, mental health providers, etc. The more input from applicable sources, the better. More than likely, if you have a private medical vendor that specializes in correctional health care, you already have an infectious disease policy in place. This policy provides you and your staff with a comprehensive plan to help you prepare for healthcare emergencies such as the coronavirus. Other applicable policies could include your personal protection equipment policy, illness and injury prevention policy, and occupational disease and work related injury reporting policy. These policies are written to address all communicable diseases and exposures rather than specific viruses, so agencies don't have to scramble to update their policies for each new threat. Outbreaks such as the coronavirus, however, create timely opportunities to review your agency's policies and plan surrounding communicable diseases and exposure control. Something to keep in mind when you're updating your plan is to identify what are all the materials, or supplies, or equipment you're going to be dependent upon. For example, items that would be affected by disruptions in your supply chain, and what are the alternative sources if that happens. Some of those items could include food, water, protest, per, personal protection equipment, medications to treat symptoms of this illness, cleaning supplies, soap, disinfectants, and of course, toilet paper. Ensuring employees follow those plans may be one of the most practical ways for employers to help keep everyone safe from infection and the spreading of infectious diseases. The Alaska Department of Corrections shared their strategy for addressing COVID-19 in their facilities. The key areas they identified in preparing for this pandemic include: number one, identifying cases. Now, this can be accomplished by implementing enhanced screening techniques for both staff and inmates. It's important that you keep a running log of these screenings so you can track any changes and be able to refer to it should a positive case be identified in your facility. Number two, isolate suspected cases. You will need to work with your medical authority in developing an escalating plan for isolation areas. It may become necessary to identify more than one isolation area should an outbreak occur in your facility. Number three, provide everyone with up-to-date educational materials and sources in an effort to keep down misinformation and eliminating the rumor mill as the main source. It is recommended that you hold daily briefings with both staff and inmates, preferably face to face. Number four, share your agency's plan on how you intend to stop the transmission of the virus by outlining what steps and provisions you have implemented or intend to implement. Those efforts should include good hygiene practices and a daily disinfecting schedule to follow for your entire facility. And number five, surveillance of new cases. You will need to identify a quarantine area to house new intakes so that you can monitor them for up to 14 days for symptoms of the virus. Staff will also need to monitor the existing population for symptoms of this virus and immediately report anything they see to medical. I encourage you to consider restricting any movement of existing inmates so as to reduce the likelihood of spreading the virus through someone not yet showing symptoms. Restricting movement now can assist you later if a positive case is identified in your facility by easily tracking any person who may have had contact with that infected person. It is crucial now, more than ever, that staff maintain an accurate account of all inmate movements and housing assignments. Again, make your plan and consult with your medical authority in formulating your agency's response, as this is a medical issue and they are the experts. With every new challenge comes an opportunity to either grow or learn or bury your head in the sand. I encourage you not to bury your head in the sand and to face this challenge head on and to use this as an opportunity to be a leader during the storm. All good leaders start by communicating with all parties involved in order to educate them on what steps they are taking to protect them from the virus and the reasons why they're doing it. Remember, people are much more tolerant of difficult times if they know what's going on. This communication is critical and should be occurring frequently. One agency stated that they have town hall meetings with their inmates every single day at a given time, and the inmates are listening to what they're saying, they're participating, they're expressing their fears, and it seems to be working well. I would encourage you to establish set times to brief both staff and inmates on what you are doing and what information you have concerning this issue. It would be helpful to include accurate information from credible sources on what is known to date about the virus, followed up with ways they can protect themselves and others from contracting it, and how your agency will respond to any potential exposures. Providing this information now should help reduce everyone's level of stress by knowing what role they play throughout this crisis. It is critical that everyone in your facility be included in receiving any new information that becomes available so that everyone is singing the same song. All staff should have approximately the same answers. This can be accomplished via shift briefings at the beginning and the end of each shift. Make sure to include medical personnel and other essential team members in these briefings. Make sure you also document the contents of these briefings for your records. Singing the same tune will reassure staff, inmates, and their families that the facility has prepared appropriately and is communicating well. It's a good idea to appoint one point of contact for press inquiries and be ready if a news crew shows up at your facility if you have a positive case identified. Make sure to have a list of telephone contacts available to all staff, phone numbers for the chain of command, the on-call physicians and nursing staff, local and state public health departments, and off-site emergency medical providers. It's a good idea to make sure to contact your local health department and ask that a jail representative be at the table for any meetings, both for planning and information sharing with hospitals, nursing homes, etc. Make sure that all employees know what is expected of them in the event of an outbreak, and designate a specific time each day to meet with them and update the inmates on what is occurring in your facility. Finally, because more is being learned every day about this virus, it's important that you stay up to date and check the CDC website regularly in order to guarantee you have the most updated information and recommendations. Next, we're going to look at a video. I want to show you a video because this is a medical issue. I've included this video by Dr. Ann Spalding. This video contains tips and information on how you can address the pandemic in your agency. This video, as well as others, can be found on the CDC website.
Hi, I'm Ann Spalding, and I am a public health physician. I've been trained in internal medicine and infectious disease. I have a master's in public health from Johns Hopkins, and I've been working in corrections since the mid-1990s. Let's talk about prevention of COVID-19 in your correctional facility. So we've heard a lot of talk about the new coronavirus. It is a type B, which is more dangerous than a type A, the type of coronavirus that causes colds. The type B is like MERS and SARS, and it causes much more severe disease. Let's talk about preventing this new disease from getting into your facility, COVID-19. What's important are a couple of things: screen and isolate. As we're talking about screening, we want to make sure that not only people who are coming into custody, but also people who work in a correctional setting will not be transporting this new virus into your facility. There are three things that we'll be doing every day. One is to screen. Make sure your staff is not coming in sick with fever, shortness of breath, or cough. If somebody is sick, as they report to work, they need to go home. You don't want somebody who should be at home on the job making everybody else who's working that day sick, making your population sick. Number two, screen people who are coming in custody that they're not with fever, cough, shortness of breath. And depending on your circumstances, you can take a temperature. Best is to have a no-touch means of taking a temperature. If the temperature is over 100.4, you need to worry about the person. Number three, know about exposures of individuals before they come, or have they been in an area where there is transmission ongoing in the community? Have they been exposed to cases on the outside prior to coming in? A correctional facility, especially a small correctional facility with a small staff, does not need to have medical be present 24/7 to ask the questions: have you had a significant exposure? Are you sick? As people come in and they're sick, for staff that can't get out of the building immediately, for people who are in custody, you want to put a mask on that person. And the type of mask we're talking about is a surgical mask, not an N95, the sick person wears a surgical mask. There may be a time when we will be running out of masks. If somebody who's coughing is without a mask, have them cough into their elbow. Make sure you don't have people coughing without covering their nose and mouth. The other thing you want to do immediately is to get that person out of the general flow going into your population. The best way to isolate somebody who is sick is to have them be in a negative pressure room. Next best is a closed room with a door. If there's a trap on the door, keep it closed rather than open. You want to keep air inside and not coming out, infecting others. Who should be transported out? People who are unstable. People who are going to fare worse with this disease are those who are older and those who are people who have underlying medical conditions such as diabetes, high blood pressure, heart disease. People with underlying medical conditions and people who are older can go downhill fast. If the community resources are not tapped out, rescue can be called, EMT could be called. If those resources are not available, the safest way to have somebody be transported is to make sure that the people who are doing the transporting have both distance and barriers. The people who are doing the transporting should have a mask, and ideally it would be an N95 mask that would prevent particles, prevent droplets from coming in and getting to them. But even a surgical mask would be better than nothing. Also, the person who is ill should be masked, and the ill person should be wearing a surgical mask. If the windows are down, it's going to be safer than if the windows are up. So consider making sure there's air circulation in that vehicle. We want to keep people spaced as far apart as possible in order to keep our population healthy. This is the time to be thinking about video arraignment at the correctional facility rather than packing people into a van and taking them. If you are able to have people have telemedicine evaluations rather than bringing them to a healthcare facility on the outside, that would be another time when people who are not sick now are not going to be around people who are potentially sick. Let's talk about keeping your facility clean. We want to clean high-touch surfaces in our jail. So the handles of doors, things that people push, the bars that people are holding on to, clean those frequently. We want to use cleaning material that can destroy this virus. If you look at cleaning material such as hospital-grade disinfectants, on the back it will say this has been tested against coronaviruses and it will destroy coronaviruses. We also have some evidence to make us believe that household bleach will also work, diluted per instructions, and you do not want to mix bleach with ammonia. One other question that comes up is how do you clean a room after somebody with COVID or high suspicion of COVID has been in the room? We want to have some time where that room has air exchanges before we put somebody else in that room. It's not immediately available for another person unless we find out more about this virus. As of now, we should wait at least 2 hours before another person is placed in that room. We should encourage people who are working in correctional facilities to stay on top of the news. We're in a people business where we're dealing with individuals all the time, and be aware of what's going on nationally, what's going on in your community. The bottom line for these times are to realize who we are. We're in corrections, and we deal with threats all the time. We deal with risk all the time, and we stand up to the challenge, and we do well. We've done well with this before. We can continue our good work. We can be thoughtful, we can be proactive, and we don't need to panic.
Okay, so like she said, Key elements are screening and isolation, right? Okay, because an effective receiving screening can greatly reduce your chances of introducing this virus into your facility, it's recommended that you consult with your medical provider to develop a screening tool and protocol that is geared specifically for this virus in both staff and inmates. This will especially be helpful to custody staff who serve on the front lines, monitoring the inmates' health as well as their own. Some current guidelines for screening staff include check all staff before entering the facility for the following: a fever of 100.4 degrees or higher, cough, shortness of breath, recent travel to a high risk country or area, exposure to someone who is symptomatic and under surveillance for COVID 19. If you have an employee that has two out of the three symptoms present, send them home. If the person is a new arrestee and they have two out of the three symptoms present, you'll need to send them. You don't need to send them home. You'll need to consult with your medical authority. We'll talk about that on the next screen. The inmate screening tool is: have you traveled from China or other international countries or states where the coronavirus infection has been reported? Have you been in contact or exposed to any persons whom may have been in any location where the coronavirus has been identified? Have you been in contact or exposed to any person who may have had the coronavirus, who may have it? Have you had today or in the last 7 days a headache, diarrhea, bloody or black, vomiting, respiratory distress, difficulty breathing, uncontrollable coughing, fever or feeling feverish? They suggest that you take the person's temperature and document it and use a handheld, no touch thermometer if at all possible. If the person answers no to questions one and two, but yes to all other questions, have the inmate place a surgical mask on themselves and isolate them, preferably in a dedicated air cell if possible. You will then need to also contact your medical provider for further instructions. These are just some sample questions, some pre screening questions that other agencies have used across the United States that I've gathered, and these are pretty consistent with most what everybody is doing now. So, controlling symptoms among the inmates and staff is very important. It's hard to imagine, but the flu remains a greater threat to community and jail health today than the COVID 19 does. Depending upon where you're located will depend on the number of deaths your state has had that have been contributed to the flu. Still, the best way we have found to prevent or curb the number of flu related deaths is with the flu vaccine. The flu vaccination is very safe, and staff or inmates who have not been vaccinated against the flu should be encouraged to do so. The better protected staff is, the less likely you are to have absences from at least one infection, and it will help avoid confusion and panic that someone has COVID 19 infection. And of course, we realize that flu vaccines do not protect against the coronavirus. It still makes sense to vaccinate the inmates for the same reasons that staff should be vaccinated. Also, given the high risk of influenza, vaccinating inmates will decrease the possibility of overloading your jail healthcare system with severe respiratory illnesses from a highly preventable cause. It is recommended that you offer and administer your flu vaccines to all the eligible inmates and staff who haven't been. Provide higher efficiency masks for healthcare and custody staff who are in close proximity within 6 feet of a person with possible COVID 19. At the present, N95 masks are recommended, but you may have trouble finding them. If you do have trouble getting the N95 mask, you can use any mask with an N, P, or R letter designation and a 95 or 100 number designation. If none of these masks are available, use simple surgical mask if at all possible. Provide simple surgical masks for all inmates who are symptomatic or showing signs of an upper respiratory infection, fever, cough, etc., and before leaving their housing unit. Inmates should be instructed to put the mask on themselves. Officers should instruct the inmate not to touch their mask or their face until medical advises them it is safe to do so or they return to their housing unit away from other people. Officers should be provided with the minimum recommended personal protection equipment and consider reducing the unnecessary movements between cells and dorms in case an infection is identified inside your jail. It is recommended that you continue to perform routine cleaning on all frequently touched surfaces, like we just saw in the video. It is important that you don't skimp on cleaning materials. Get as many as you can and keep them on hand. Keep an ample supply of soap and paper towel dispensers available for the inmates to use. For infection control and to help reduce fears among the inmates, it is wise to adopt a liberal approach to inmates who want to disinfect their houses. Give them the materials they need to do so. Put them to work. The minimum personal protection equipment recommended is a single pair of disposable examination gloves, disposable isolation gowns, or single use disposable coveralls. This is especially helpful for staff who are conducting these new screenings of the new arrestees, as well as staff who are conducting screenings of visitors, people coming into the facility. Any NEOSH approved respirator, an N95 or higher level respirator, and eye protection, goggles or disposable face shields that fully cover the front and sides of the face is recommended. That's recommended for folks who are doing the screenings as well. And a handheld no touch thermometer for use at intake and in medical. Your visitors policies should be updated right now. Because of the ease of spread of in jail setting, the severity of illness that occurs in residents with COVID-19, facilities should immediately restrict all visitation to your facility. Notify your visitors, the family members, via letters, emails, even social media, your social media page for your facility, advising them that no visitors will be allowed in your facility during this time. Consider utilizing the use of alternative methods for visitation too. Video conferencing is good. Maybe the iPads. Maybe work with your phone vendors to see if they can offer you something during this time. Um, these video conferencings are especially helpful if attorneys or clergy is needed to come into your facility. Post signs at the entrance to the facility advising that no visitors may enter. Attorney and clergy visitation should be decided on a case by case basis, which should include careful screening of any fever, respiratory symptoms of the virus. Those with symptoms should not be permitted to enter the facility. Those visitors that are permitted must wear a face mask while they're in the building and restrict their visit to the area designated by staff at the time of entry. And finally, any visitor allowed should be reminded to frequently perform good hand hygiene, practice coughing and sneezing into their elbow, and refrain from touching their face. Transporting outside the facility is not recommended at this time if you can get by with it. If possible, all medical trips to outside providers should be postponed. Custody staff, however, should refrain from postponing scheduled medical trips without the prior authorization of your facility's medical authority. This should only be done after your medical authority has provided documentation to you that a delay has been reviewed and approved. If your medical provider has the capability, consider utilizing telemedicine to prevent outside trips. If your facility is not using the electronic medical records, which is a HIPAA compliant software, make sure to discuss with your medical and legal counsels the risk and benefits of using readily available non HIPAA compliant software for instance, FaceTime on your phone, in order to facilitate those telemedicine protocols. If court appearances are scheduled, consider reaching out to the court to arrange for video conferences or rescheduling if necessary. It's important that you understand the difference in these two terms because sometimes people use them interchangeably. Isolation is used for inmates that have been identified as being sick or showing symptoms of the virus. Quarantines are used for those inmates who are not showing signs of being sick, but who have been exposed to someone who is sick. Isolation. Staff should encourage inmates to notify them as early as possible if they experience symptoms associated with the virus or infection. The goal is to isolate those who are showing signs of illness away from the rest of the population. And because inmates often associate isolation with punishment, which may cause them to delay in notifying you if they feel symptomatic, it's a good idea to try to make the isolation less punitive and provide them with ample access to comfort, such as entertainment, activity related materials that is allowed per their custody level. In other words, try to think outside the box to promote them into telling you that they're feeling sick so that they don't avoid trying to get into isolation. Your medical authority are the ones who you need to be relying heavily upon right now. This is a medical crisis, and they are the experts. They should be aware and stay up to date on all clinical guidelines suggested by the National Commission on Correctional Health Care, as well as the Center for Disease Control. Your medical authority should also share with your local health department what your role is in preventing, identifying, and managing this disease in your facility. It's a good idea that you remind them that you are in their territory. And just because you have healthcare staff, which might be a private vendor, doesn't mean that the health department should not consider how the presence of a jail and prison and movements of citizens in and out of the facility impacts the health of the public. So start planning now where you're going to place people if they're diagnosed with the coronavirus. You want to put those people who have been diagnosed together, but at a distance from folks who are well. If many people are sick at the same time, it's a good idea to start identifying those areas, their quarantine areas, your isolation areas now before you need them. Use a dedicated air cell if possible, and consider using an unused section of your jail if you have those, and I know those are few and far between, or a separate smoke zone for those inmates requiring quarantine. If you don't know how many smoke zones you have in your facility, it's a good idea to consult with your HVAC provider, look at your blueprints for the facility, and see what areas you have available to you. Some other considerations, these next two slides are going to contain some important information your agency needs to consider when formulating your plan of attack against this virus. So they include implement sick leave policies that are non punitive, flexible, and consistent with public health policies that allow ill staff to stay home. Ask staff to regularly monitor themselves for fever and symptoms of respiratory infection and report any symptoms that they feel to their medical provider and the supervisor. Remind them to stay home if they're sick. You don't want them there spreading it to the rest of the community in your facility. If they should develop symptoms or fever during their time at work, they should immediately put a face mask on, inform their supervisor, and isolate themselves from other folks. You'll need to consult occupational health on decisions about further evaluation and returning to work. Make sure you screen all staff at the beginning of their shift for fever and respiratory symptoms. Actively take their temperature and document the absence of shortness of breath, new or changing cough, and sore throat. If they're ill, have them put a face mask on and leave the workplace. restrict non-essential healthcare personnel, including consultant personnel and volunteers, from entering the building at this time. When transmission is in the community is identified, the facility may face staffing shortages. Facilities should develop or review existing plans to mitigate these staffing shortages. This is both for medical and custody staff members. Jurisdictions need to understand that incarceration of persons defying quarantine orders could lead to exponential increases in jail cases and cases in the community. So those folks who don't want to adhere to isolation and the courts decide to lock them up, we need to keep that at a minimum if at all possible. Measures other than detention should be considered, such as at home electronic monitoring, compassionate releases, low bail assignments. You'll want to go through your population now and start making a list of those folks who are most vulnerable, um, those who have nonviolent offenses, and hopefully you can work with your courts and judges and magistrates in maybe getting these folks home or an alternative to incarceration. Custody should plan on future absenteeisms of ill correctional officers if an outbreak becomes is in your area. Remember that the supply chains of your medicines, your food may become disruptive if this gets to a greater level. So you'll need to keep that in mind when you're compiling your resources. Consider alternatives to incarceration in order to keep stock populations down. The health department should be notified about residents with severe respiratory infections that you have in your facility, or a cluster of residents of three or more. That could include your health care personnel, staff, anybody with symptoms of respiratory infections. The next slides contain some educational information about the coronavirus and how it is transmitted in ways that you can help to prevent it. I'm sorry, folks. This is just one example of some of the materials that's available to you. There are different ways in which you can accomplish getting educational materials to the inmate populations and to your staff. One way, and a simple way, is to utilize your facility's closed captioned TV capabilities. Run it on the inmates' programming at least once an hour. You can also find other instructional videos on the CDC website and share them with them as well. By playing these simple videos, folks, you will help to keep everyone calm and informed, which in turn can help alleviate unnecessary fears and even keep down grievances and complaints. I would encourage you to play these videos on rotation at least one time an hour in each of the living areas of the inmates. This video you see now is and can be found on the CDC website. No doubt many of you are fielding questions already, or concerns, or maybe even requests for soap, maybe even for hand sanitizers for the inmates. We all know that hand sanitizers contain alcohol, and the CDC recommends that sanitizers contain at least 60% of alcohol content. More of them are saying 70%, but at the minimum 60% of alcohol based. What we don't want the inmates to have them, of course, if at all possible. This video will assist you and your agency in quashing any of the rumor mill that, hey, they're not providing us materials to sanitize ourselves. They're only giving us soap. This tells you that soap is just as effective or more, and that you don't have to have antibacterial soap, etc. This slide is, I would recommend that maybe you print this slide off, copy it, laminate it, post it around your facility to provide educational material to everybody involved. Um, You could put this in the Sally port, you could put this at booking, you could put this in the inmates' living areas. Other areas could be the kitchen, laundry, your outdoor rec areas. The more it can be seen, the better. I also recommend utilizing the CDC website for more educational posters. They have um, all kinds of posters available that you can print in your facility, 8.5 by 11, I think, not much bigger. It will help quash the rumor mill for everybody and educate everybody properly instead of that relying on that rumor mill. Symptoms overview is another one you could print out here. As you can see, many people infected have mild or no symptoms at all. Symptoms can appear soon or long after contact with an infected person. This could be 2 weeks, somewhere in between. Serious disease and death are most common in older persons or those with underlying medical conditions. Some common symptoms are fever, cough, shortness of breath, which sounds an awful lot like the flu. Another slide that I recommend you could print off for the inmates or your staff to review. Some prevention techniques here: avoid close contact with people, avoid touching your eyes, your nose, your mouth, cover your cough, sneeze with a tissue or in your elbow, wash your hands and soap with soap and water frequently. Wash for 20 seconds. They recommend you sing the happy birthday song, and then once you're finished, you've got the 20 seconds. Clean and disinfect frequently touched objects, so on and so forth. We went through the majority of these already. Please note that this presentation contains information extracted directly from most recent information published by various sources in the jails to help you prepare for the impact of COVID-19. Each one of the slides contained have the specific information I used, where I found that information. Uh, Please consult with the CDC website regularly because this information is changing constantly. Make sure to consult with your health department and remember your jail's medical director has ultimate clinical responsibility for the health of the inmates and you in the facility. Make sure to include them as well as any other agency you may be dependent upon for assistance when developing your plan of action. Here is a complete list of the resources that I used in this presentation. I sincerely hope and pray that this virus does not find its way into your agency, into any of you or your families, and that we all get through this safe and healthy and better for it.